I don't know if you noticed, but I didn't ask him to like tell me his history and stuff because I don't like listening to that. But I will tell you that when he told me about the book that he was writing, or that he had written, I got very excited. So this is really about me.
It's all about you, Karen.
I have a sister who graduated from Wellesley and moved to Washington, D.C. and never looked back. And after many, many years of visiting her, one thing I noticed was that it didn't matter what your politics were. What I noticed was that everybody in Washington, D.C. was passionate about what they did in their life, and government was the central force that tied everybody together. So I was very intrigued by Lynn's book, and I read it, and I just found it so easy to read and so true to what I had experienced from just a very peripheral point of view. And so I just am excited that he's here to tell us a little bit more. So
thank you,
let's give a round of applause.
A couple of thank yous. First, Karen and Murray. Secondly, my co-authors here, Mary and Ehrlich, without whom there wouldn't be a book. And this event is also co-sponsored by Sweet Cup, yes. And that's be next door. Jasmine and I have become friends over the last, I guess, 3 years when I was pointed around the corner for a cup of coffee when I was working out at Timberline. If you haven't been to Sweet Cup, you need to go to Sweet Cup. And if you want to know why, you will find out after I'm done. And the chocolate sorbet is named after me because I've been pushing it like crazy.
And actually, it's sold out already.
It's sold out?
Yes.
Oh, I didn't even get in. So I want to do two things tonight. I will not take a long time. The book really has two big pieces to it. The first piece is exactly what Karen talked about. How does Washington work? Because most Americans don't know. I've given a talk about health policy to thousands of people. 2 knew how the health care bill was passed. Literally, 2 people have said, when I asked the question, did the bill follow regular order? I'll tell you what that is in a second. They said, everybody says yes, and the answer is it did not. So the first thing to know is that the health care bill that is so controversial ought to be controversial because it didn't follow, frankly, the rules. The second part of the book, which will come as no surprise to people in this room, is about me. I will say that second, because when you write a nonfiction book, when you write a fiction book, you create the context. You basically decide what the world is going to be. When you write a nonfiction book, you select the context. It's there, you just got to pick it. So I will tell you what I learned first, briefly, and then I will outline the context of why I think I really wrote the book. It took me a long time to figure out why I wrote it, which sounds crazy, but that's what happened. So the title of the book is Red Kool-Aid, Blue Kool-Aid, How Partisan Politics and Greed Undermine the Value of Obamacare. That title does offend some people because they think for some reason that I am pro-Obamacare. I'm neither Obamacare. I'm just sort of neutral on the whole thing, and we'll talk about that as we go along. But the first question is, why in the heck is the healthcare system being discussed in Washington anyway? The first answer is, we spend more per capita on healthcare than any other country in the world. We spend somewhere between $8,000 and $8,500 a piece for every single human in the country. No other country spends more than like $4,000. So
except East Timor.
Except East Timor, right? Well, you're reading the slide, so you're a reader, not a listener. When I made this slide, about 50 million Americans did not have any access to health insurance. And let's get one thing straight from the beginning. This bill was not about health. This bill was about health insurance. And that's a big, big difference. And we'll talk about that as we move along. But we are the only westernized democracy in the country, in the world, including East Timor, that does not have some sort of universal health care, which is very, very strange. So, there are 4 basic healthcare systems in the world. The Bismarck system, which obviously originated in Germany, where you have private practitioners and private health insurance. The only difference is it's a non-profit basic insurance. So when somebody says Germany has socialized medicine, they do not. And many countries, including France, Germany, Japan, and Switzerland, some of the best healthcare in this world is under this system. The second system is the beverage business system. That's the one in England, and that is socialized. The docs are owned are paid by the taxes, hospitals are the taxes, everybody has access to healthcare. It is a socialized system. The third is the national health insurance, which is in Canada. I'm looking at you. In which the docs are private, but the insurance is public by province, not by the entire country. It's not the same as Medicare. And there are people who will tell you it's a great system, they're usually healthy, and there are people who tell you it's a lousy system, they're usually sick. So people from Canada come to Buffalo to get an MRI because they don't want to wait 6 months. But that's all true. I mean, that's happened. The last system is no insurance at all. So the question then becomes, which of these four systems is at play in the United States? And the answer is all of them, and that's part of the problem. So if you are a worker under 65 and are insured by your company, you are in Germany. You have private docs, private access, and private insurance. If you are an Indian, a veteran, or in the United States military, you are in Great Britain because you have the VA system that you have no choice about, and that is paid for by the taxpayer. If you're on Medicare, and I see a few of you in the room who just might be, including me, you are basically in Canada. You have access to docs, but there's a single payer. And lastly, if you're uninsured, you're in sub-Saharan Africa with emergency rooms. And the reason I add the emergency room part is because, I'm sorry.
Thank you.
You're welcome. But he's an emergency room. The reason I add the emergency room is because by federal law, any human being that walks into an emergency room must be cared for. No matter whether they're an immigrant, it doesn't matter. They have to be cared for. After that, that's a different story. So the one thing I found in Washington that people did not talk about ever in the entire 9 months on the Hill was, what is health care? Is it a right or a privilege? Is it like the police, where we all have access to it, or is it like Gucci loafers? And why is that important? And the question becomes one that never got discussed and has yet to be discussed. I have to be careful with these slides because there are about 12 between that one and this one when I give my normal talk. This is how a bill passes the Congress of the United States when it's done properly. It can be introduced in the House or the Senate unless it's a money bill. Money bill must be introduced in the House of Representatives by law in the Constitution, Article 1, Section 7. Bills then immediately go out to committee for discussing what's called markup, where they decide on amendments and they yell and scream at each other. And then the bill has to be reported out to the floor. If the bill is reported out to the floor, that means it passed the committee, and the floor passes it, it is not yet a bill. I mean, not yet a law. It is not a law yet, because that has to be the identical language in the Senate and the House. If the Senate and the House have different versions of the bills, they have to go to conference committee, where members of the Senate and members of the House from both parties argue again and have amendments and finally get the final bill, and that goes back out to the House floor and back out to the Senate floor. The single bill is passed, and then and only then it goes to the President's desk. So I asked this group, is that what happened with the health care bill? As I've alluded to, it is not. What happened? You are, I got nothing but bright people in front of me. Some of the smartest people I know. And no one knows how the bill got passed.
It was so big, nobody wanted to read it and just passed it.
That still doesn't get to the issue of that in November of 2009, the House passed a version of the bill. On Christmas Eve on 2009, the Senate passed a version of the bill, and they weren't the same version. How did they reconcile it, and why did they have to?
Somebody rounded through.
Who?
Yes.
Nancy Pelosi.
Yes, Nancy Pelosi, and here's why. In Washington, there are 4 P's of government: policy, process, politics, and personality, in ascending order of importance. When I got to the office I worked in, which was a Republican office, they had already decided on policy. There was no discussion about what they thought about anything. I was in a meeting where they were discussing a cancer bill that it actually got rolled into the ACA. I was the only person in the room, and there must have been 30 people in the room, who was at M.D., an oncologist, had put a patient on clinical trial and had written a clinical trial, the discussions about clinical trials, and they were totally uninterested in what I had to say. That's your government at work. It was a bunch of 25-year-olds sitting around the table arguing about what their bosses wanted, while their bosses were out eating rubber chicken and raising money. That's how Washington works. So if this went on like it should have, personality should have been the most important. So, another quiz. Who were the two people who were missing in action in the healthcare argument that caused this thing to go on for so long?
Teddy Kennedy.
Teddy Kennedy was one. He died. Bad move. Who was the other?
Donald Trump.
No.
But close, the president.
It could have been if he had gotten involved, I'm sure.
The president.
Now, I'm the president. It was Tom Daschle. If you remember, the initial appointment to be the Secretary of Health and Human Services was Tom Daschle. And he was always also going to hold the title of healthcare czar. He didn't pay his taxes. And the New York Times came after him. Oh, just a little bit, just $5 million, you know, just to live as he serves. And they just pounded him, and he withdrew his name. Tom Daschle is the only person who's ever been the majority and the minority leader of the United States Senate twice. You think he would have known how to get a bill through? If Teddy Kennedy and Tom Daschle was in the mix, they would have gone with Mike Enzi, my boss, down to the office of Orrin Hatch, and they would have sung Irish drinking songs, and we would have had a bill. Long, long, long before we ever really had it. Because the key personalities on the Democratic side were missing in action, and the bill was left in the hands of people like Max Baucus and Chris Dodd, it didn't get done. Well, neither of whom are still in Congress, by the way. It did not get done the way it ought to have gotten done, and it was nitpicked to death. So what do we really mean when we say healthcare reform? What is being discussed? It's access, cost, and quality. Access. Who gets to see a doctor? Cost. How much does it cost? How do you pay for it? Quality. How good is it? Which ones of you, I got to be careful because I have some doctors in the room that are actually my doctors. But how many of you have good doctors? Now, other than you and a couple other people, how the hell do you know? You know more about your cell phone than you know about your doctor. How do you know he's good? Because he's nice? Because he has People magazine in the waiting room? She. Excuse me. Touche.
How long in politics?
I'm not in politics.
Oh, that's
I'm in policy.
Right.
See, I'm up higher on the list. I'm not in politics.
Personality?
The question is good or bad. That's the question. So the problem is we really don't have a scorecard for our medical care. So we don't really know what quality looks like. And the problem with reducing costs is if you reduce costs, you reduce somebody's income. Nobody's happy with that. So what this bill was about is not cost or quality. The Republicans won as soon as the bill began to be discussed because these got off the table. There are projects in there about it, but it's not really there. This is the meat. The meat is access, and access has been interpreted as being insurance. So the question is, who gets insurance? So that's what I was describing to you, is this is what it was. In the dawn of 2010, Teddy Kennedy had died, Scott Brown took his place. The Democrats had lost their 60 seats in the Senate. In the United States Senate, any one senator can call for a filibuster. It takes 60 votes, not 51, to override a filibuster. And the Democrats did not have the 60 votes any longer. If it had gone to conference committee, it would have failed. So when I was sitting here in Houston, or Bastrop, looking at this, I was thinking, when Teddy Kennedy died and Scott Brown got his seat, this was dead. There was no chance we were going to get a bill. But we did get a bill, and this is why, Nancy Pelosi. She took the passed Senate bill and rammed it through the House. There's not a single Republican vote in either House of Congress for the most significant piece of social legislation passed in the last 50 years. It's nuts. And the president says, this is a big deal. Well, it's not that big a deal. It's a big-ish deal for those who get more insurance. So what does the Affordable Care Act really do? Like I said, it's the largest piece of social legislation. It was supposed to insure 32 to 34 million more people. It's about halfway there. And it's also not clear, when they give you that 16 million people got insurance now, it's not clear how many of them had insurance. Because some employers are basically telling people to go into the insurance markets and are withdrawing their insurance, and they will make their employee, I better not say this in front of Murray, but I don't mean no.
I didn't do that.
They are
We're all covered.
they're throwing their workers into the exchanges, and they'll pay the penalty. Why? Because the penalty is a fixed cost that they know. They can plan for that. They can increase the size. You know, he can increase the amount of a suit by $10 and cover that cost. But the cost for premiums keep going up. In fact, there was just an estimate today that healthcare costs are going to go up 5.8% over the next 10 years, which is ahead of inflation. So the idea that anything about this bill controlled cost is not true. It's just not there. It was 2,000 pages long, as you said. No one read it. As Nancy Pelosi said on the floor of the House, we'll know what's in it once we pass it. You can look it up on YouTube. You can see it. The Congressional Budget Office scored this bill at $143 billion of savings. How do you increase the number of people insured and save money? Nobody believed this. But the key with the CBO is that they only scored 10 years. Most of the savings that are in this bill were in the first 5 or 6 years. All the costs are in the out years. And they only scored the first 10 years. That's all they have to do. And you thought your government was honest. No, you didn't. Anyhow, I know you didn't. Then